Greetings. I'd like to describe some of the technology behind MoTeCH, which is a cell phone based application for improving community health in a rural district of Ghana. We'll look at the two main components behind MoTeCH. The first is a server-side medical record system called OpenMRS, and the second is a cell phone based mobile data collection application which we refer to as MForms. We will not provide a lot of context for this demonstration. It will primarily be a technology demonstration, but we encourage you to look at the YouTube that has a lot more detail and some of the visual imagery in that wonderful region of the northeast of Ghana. When we describe the OpenMRS application in this presentation, we'll primarily focus on the functionality that MoTeCH adds to OpenMRS. We'll go to it in a little bit more detail in the mobile application. We'll indicate how we get the mobile application. We'll talk about the distinction between studies and forms and recognize that studies are simply groupings of forms. And then lastly, we'll look at the process of uploading data. There will be additional videos that will look at the mobile data collection in a lot more detail. For example, registering a patient or registering information associated with an antenatal care visit or the delivery of a child. So we start with the server-side application. In Ghana, we have a single server which is located in a secure facility, and we'll start by logging into the system. As we've said, it's a medical records system, and MoTeCH is layered on top of this medical records system. Selecting the MoTeCH option at the top gives us a submenu, and the submenu have various entries for defining facilities. And when we define the facilities, we add information about the cell phone numbers because there's a messaging component that uses that cell phone number. Staff also are registered with their cell phone numbers. We can register patients using the web-based application, and in this case the scenario, normally patients are registered using the mobile application, but the server side can also register patients, and the scenario is someone wants to be registered as part of MoTeCH, and they call up the call center and they give the information over the phone, and a call center staff enters it into the server. We can search for patients in the system and find out more detailed information about their encounters and the data that's been entered. We can also manage troubled phones, which are phones that are no longer receiving the MoTeCH messages. And lastly, we can indicate blackout periods, which are blocks of time where we don't want to send out messages. An example might be when Ghana's playing in the World Cup, we probably want to minimize the number of messages that are sent out. If we look at some of the fields for registering patients, the beginning part are the normal fields that we'd expect. But the end of the form concerns what MoTeCH calls the mobile midwife, which is the messaging system that allows patients to receive messages about upcoming care visits or general health tips that are sent out on a regular basis. We have a number of different, we've got 3 different models for phone ownership. Somebody can own their own phone. The phone can be owned by a household, or it can be a public phone. The importance of this is when we call the woman up, the manner in which the woman gets the message is dependent on the type of phone. If it's a public phone, then she needs to call back into MoTeCH with her ID to get the information. We have 2 different formats for messages, either text or voice. We started out with a text-based application, but based on the literacy rates in the Upper East, quickly realized that we would have to have a voice-based component to MoTeCH. And we use an interactive voice response system, IVR, for sending out voice messages to patients. There are 3 different languages that we support. Messages can be sent out in, patients can select any one of these 3 languages for messages. Patients can also designate what day of the week or what time of day that they'd ideally like to receive messages, and MoTeCH will send out those messages during that designated time period. That was a very brief overview of the server side of the MoTeCH application. Let's look to the mobile side, and the notion is that each nurse has their own mobile phone where they're entering in service delivery information or querying the system for information that's part of their work. In Ghana, we use the Nokia 1680 phone, which is a $35 phone that has that's Java enabled, has a Java runtime engine on it. In this demonstration, we'll use an emulator to show how, what the MoTeCH mobile forms looks like. When we start the M-Forms application, we're asked for a username and a password. We log into the application, and we're presented with a menu. The first thing that'll happen, a nurse will download studies. There are 3 studies in MoTeCH, and then once they've downloaded the studies and downloaded the forms associated with the study, they'll select which study or which form they'd like to enter in information. So let's look at the studies associated with MoTeCH. There, as I said, there are 3 main studies. The largest one is the nurse data entry study. There are some 16 different forms associated with nurse data entry, and they primarily concern the registration of patients or the recording of service delivery that's part of their normal routines. The nurse query study gives the ability to query the back-end server for more detailed information about a patient, a particular patient, or the nurse can query and find out all those patients who have not made their last appointment. The third category of studies is the field agent form. Field agents are generally not nurses, and what they would like to do, though, is record information that's critical to MoTeCH operations. Probably the single most important is the process where a community volunteer reports the birth of a child, and this information is relayed to MoTeCH, and then MoTeCH relays the facility that that patient is registered in, and the nurse associated with that facility is expected to go out and visit that child in a timely way. These messages are sent to the facility every 6 hours until somebody goes out and visits that child and records the information associated with that visit. Let's look at the details of one of these forms, and I'll look at one of the nurse forms. As I said, there are 16 different forms that are associated with nurse service delivery or patient registration. We'll look at information, entering information about visiting a pregnant mother, the ANC visit. In the ANC visit, there are a number of fields that can be entered. The mandatory fields are designated with a question mark. If you try to save the form without these mandatory fields filled in, it won't allow it. Some of the fields, if we select the entry of tetanus, we're given a limited number of options. In this case, there are up to 5 tetanus possibilities, depending on which one in the sequence they're receiving, or of course none of the tetanus is an option as well. So the nurse will select which one in the sequence, and as part of the recording of visit information. When they're finished, they'll save the form. If I try to save this form, since I haven't filled out all the mandatory fields, it won't allow that. Let me go back and finish off the overview of this application. After the MoTeCH mobile application can run in disconnected mode, which means that there may not be mobile phone coverage in the areas that they're collecting data. Once they get back into an area where there's cell phone coverage, they can choose the upload data option. The upload data option is very easy. We simply indicate whether we want to upload the data. If we choose yes, then the data is uploaded to the server form by form, and server-side validation checks are applied to this form. If the IDs are incorrect or other information does not pass the server-side validation checks, then the form will be left on the phone. The forms that successfully upload to the server are entered. That information is channeled into the OpenMRS medical records system, and there's an option to remove that form, remove that data from the mobile application. This has been a brief description, overview of the mobile application, and as I said, later videos will provide more detail. Specifically, we expect to have videos that describe the registration of patients and all the fields associated with patient registration, or the recording of information associated with an antenatal care visit, or the birth of a child. Thank you very much for your attention.